as a new mutation. Those could be things like Klinefelter syndrome, and where conditions where there's an extra X chromosome in the male. Instead, the male should normally have one X chromosome and one Y chromosome, but in some men they have two X chromosomes, and it's normally due to something called non-disjunction, where they've inherited an extra X chromosome from their mother.
Oh, wow.
But these are all very rare, but we are able to pick them up, and there is treatment for them, and that's again the big thing. There is treatment, because although these men are not producing sperm, because they're affected by their testes decreasing in the amount of sperm they produce and ejaculate, and so they may have zero sperm produced when we do a semen analysis. However, we are able to sometimes find sperm when we take a biopsy directly from the testes, and this sperm can then be used to treat their partner.
Mm-hmm. That's interesting. Now, of course, since we got a little bit of a glitch and we took a brief commercial break, we are not going to take any other. We have a WhatsApp number that's displayed on the screen, and trust me, you already have people participating. Now, this will go out to you, Dr. Judith. Good morning. May I know from the doctors what makes a woman stop giving birth despite having children with the man having used family planning? This is Patrick Abim from Arua. He would like to know.
If I've understood the question clearly, he's inquiring what makes the woman fail to give birth, but when he has had maybe other children before, and he's linking it to the family planning. If I can relate infertility to family planning, there are some family planning methods, if someone is using, may delay conception compared to others. The easiest we know of is the 3-monthly injection. If you're on that injection, your fertility may delay to return. Like for a year, for some people it may take up to 2 years for the fertility to return. But it shouldn't be something permanent that it has caused complete failure to conceive again. We shouldn't attribute it to family planning if it has taken maybe 5 years and you were on an injection for 3 months, maybe 5 years ago. It may be something different. Even when you have given birth before, a lot of things can happen along the way. You can develop blocked tubes. Just like we've talked about the sexually transmitted infections, they affect both men and women. So in women, certain family planning methods which can put you at risk of maybe the infection moving up to your tubes, maybe an intrauterine device, the IUD. If you find maybe you have multiple sexual partners or your partner has multiple sexual partners, it puts you at risk of the infection going up to the tubes, and you can have blocked tubes despite having given birth in the past. But some women, even though like maybe 30 years, 35, they may develop premature ovarian failure. And someone has given birth before, but their ovaries have stopped producing eggs very early, before the age of 40. So in that case, really would handle each case differently. I must say the causes are quite many.
Now to you, Dr. Moses, I'm sure earlier on in the show you spoke to some of the common factors that contribute to male fertility issues, or infertility issues actually, but I'm sure this person has just joined in from Namugongo, and they would like to know, this is Samuel from Namugongo, and they would like to know what are the factors that lead to that condition.
So which condition?
The condition of factors that contribute to male infertility or fertility issues. That's what he said. He doesn't say infertility, but he's talking about fertility.
That contribute to fertility. Okay, since this is a male fertility show, I'll say quickly, male fertility is broken into 3 different groups: pre-testicular, testicular, and post-testicular. So pre-testicular is mainly where you find the causes due to either a low testosterone, where the pituitary gland that actually controls the production of sperm is low. And these could be genetic, these could be due to treatments such as previous chemotherapy for cancer. It could be due to if let's say someone is a very active sports person and takes maybe things like testosterone or steroids to help them perform in the gym or in sports, these could contribute. And these are all pre-testicular factors. Testicular factors is where the test itself has an issue where it's not producing sperm properly. Those could be because of an inherited disorder, such as Klinefelter's, a genetic factor, as Klinefelter's. It could be because while you were a child, you had undescended testicles. It could be because you had mumps as a child, which has actually hampered the actual functionality of the testes. And then lastly, post-testicular. And this is really due to, we normally call it obstructive causes, where your testis is producing sperm, but it's not able to get to the urethra to be ejaculated as normal because of a blockage. It could be to an inherited disorder such as cystic fibrosis. It could be due to a previous infection, such as STD, blocked the tubes. It could be because of what we call retrograde ejaculation. This is very common in people with diabetes, whereby when they ejaculate, diabetes affects the nerves in the urethra, and normally when you ejaculate during sex, it closes a sphincter, the muscle that controls urine coming through the urethra, and closes it off while ejaculation occurs. However, in some men with diabetes, it affects the nerves, and this sphincter does not close, and therefore the ejaculate goes backwards into the bladder. So all of these are what we call post-testicular. So these are the three sort of subsects of the causes of male infertility. Mm-hmm. For infertility in general, there are lots of things which we covered last week, such as for the woman, if she's not ovulating, whether she has blocked tubes or a problem of the uterus with implantation. I hope this answers. It's a very broad question to discuss all the causes of infertility, but I hope that briefly covers most of what he's asking about.
Okay. Then still back to you, Dr. Moses. This is Feli from Lira. Can a man with low sperm count be successful on IVF?
Yes, is the answer. Men with low, and in fact, a lot of IVF has successfully treated men with low sperm count, and it really improved after the development of something called ICSI. ICSI stands for intracytoplasmic injection. With normal IVF, with routine IVF, when we collect women's eggs, we put them in a Petri dish, and then we get sperm, we spin it and prepare it, and we pour the sperm into the dish with the eggs, and you allow the sperm to swim on their own and fertilize the eggs. That is with men with a normal sperm count. With men with a low sperm count, doing that, there is very poor fertilization. However, ICSI, which I've already described, which is intracytoplasmic sperm injection, was developed in the early 1980s, whereby the embryologists who are in the lab are able to look under the microscope and see the best quality sperm and pick it up with a microscopic pipelle and inject an individual sperm, just one sperm, directly into one egg. And this improves the fertilization rate and the success, such that men with very low sperm, their success rate is just as good as men with a normal sperm count.
Wow, that's very interesting. Now to you, Dr. Judith. This is Rebecca from Bunyangabo district, and she's appreciating and saying she's learned quite a lot, but she'd like to find out whether you also do fallopian tube unblocking, or you majorly only carry out IVFs at the clinic.
Thank you very much, Rebecca, for the question. Fallopian tube unblocking, it will depend on how long the condition anyway has been for the success. We do it, but we can't guarantee success after the procedure. So we can do the tubal flushing, and then we monitor if the tubes respond. If no improvement, if they have not opened up, then still the solution will be IVF.
Okay. Then this is Alex from Kawempe. what does cloud or white forms of urine mean? Because they also would like to know what is the actual color of urine.
Okay, the normal color of the urine should be pale yellow, but if it's quite concentrated, it can be a bit deep yellow, and it can be little, depending on how well you're hydrated. But cloudy urine, maybe urine which is foul smelling, maybe associated with pain, you would need further investigation on that urine. But as well, from what Dr. Moses has talked about, the retrograde ejaculation. Some people may have intercourse but have very little or no ejaculate. So such people may have retrograde ejaculation in that the semen, the sperms can go to the bladder instead of coming out through the urethra. So causes may be infections for any serious changes in the urine color, or even like retrograde ejaculation.
Okay, and then still this will go to you. Is it possible to go for such tests even when you don't have such underlying conditions? And this is Cosmos Ogwang from Abim district.
Yeah, I must say being health conscious is very good, and I wouldn't, like a young person, you can walk into the clinic to know your fertility rate. You can walk in to know your semen analysis as a young man, even before you're married. Say that you know that your system is working well. There is no age limit. You can come in, provided you want to know your health status. It's just a semen analysis for the man. For the females, it's good. You can know your ovarian reserve. You can know your hormonal levels. I wouldn't discourage it.
Okay. Now to you, Dr. Moses, is it possible to do a DNA for a woman who is pregnant, who is 1 month old pregnant, and find out the father? If that DNA can be done on that woman, is what he would like to know. This is Mukisa from Muyenga.
It's not really a fertility question. It's more of a paternity question. It's not really in the realms of what we do at Fiona Fertility. There are other laboratories, other centers that could carry this out. It can be done, but it's not something that we personally do at Fiona Fertility.
Mm-hmm. Then there's one from Rukunjiri, because I would really like to say that I'm appreciative that they are participating in the show, and he would like to ask, what causes a man to ejaculate very quickly?
So that sounds like premature ejaculation, and the main cause of this is really psychological, and it can be treated with, first of all, some psychosexual counseling, whereby they can discuss what the underlying psychological reason is for premature ejaculation. So they are special. We do have our counselors who do actually specialize in psychosexual counseling, and this can be addressed with that. If they rarely, but it does occur. Sometimes there is an underlying clinical reason, but for vast majority of people who ejaculate very early, even perhaps sometimes before even actually penetrating their partners, it is a psychological reason, and it can be addressed with psychosexual counseling.
Mm-hmm. Then to you still, Dr. Moses, this is Toto Flavia from Namugongo, and she's inquiring, why does a man produce a specific sex of children, let's say like girls from one woman, and then boys from a different woman?
The sex of the child is determined by the father. So the sperm either carries an X chromosome or a Y chromosome. You can this is something that would happen spontaneously unless it's done through an IVF cycle. This would be done, but the man or the woman would have no control on, if they're conceiving naturally, on what the sex of the child will be. And so it is purely by luck that one of the wives had all girls and the other wife had all boys. It's purely down to chance. It has nothing to do with whether he is doing anything different when conceiving. This can be, when you go down the realm of IVF, you can have gender revelation of the embryo, and then you can determine whether the child is going to be a boy or a girl. If a partner is just conceiving naturally, they have no control over that.
Okay. Now there is a person asking, this is Fred. I've been having clients complaining of ejaculating, at times of ejaculating nothing comes out, but later semen oozes out slowly. Is there any help? Dr. Moses, I think I would throw that back to you. You might be in a position to explain that to Fred.
Yes, there is helpful for, and it is something that I've seen occasionally, whereby the man climaxes without actually ejaculating. And again, one of the things that could happen with that is if he has a history of chronic conditions like diabetes, which is affecting the sphincters, because all of these things, with the process of sex, there's a lot of coordination of different muscles, different sphincters that control the ejaculation. So if the man has had something like diabetes, which affects the nerves, control the ejaculation, there is a miss of when he ejaculates and when the sphincters open or close. Mm-hmm. Other things are if.
Oh wow. Dr. Moses, okay. We will, Dr. Moses, I hope you're still with us and would like to hear from you. Sorry about the network issue, because we do really appreciate, and we know he's participating all the way from Dubai. When we still are able to get him right, he will still continue on the conversation. Now, I'd like to get, this was addressed to Dr. Moses, but I think you as a female would be in a better position. I'd like to know what causes to take too long without seeing periods, and what is the outcome, and what would have been the solution to this problem. I know some of them are still following up on last week's conversation. Somebody has delayed periods.
So, like as a woman, would expect every girl by the age of 16 to have had her first period. So, we would encourage everyone to be health conscious. If you're a mother and the girl has reached 16 years and she hasn't seen a period, maybe you would screen and see how the hormones are doing. Mm-hmm. There may be delayed puberty in some children, both for males and females, in that there will be a delay in the initiation of the menses as well. So if maybe a girl is now 20 years and she hasn't had any periods, sometimes we would need to do the hormonal profiling, because there are hormonal causes of no periods, but also there are genetic causes. So we would begin with checking maybe the system, doing a scan to see if everything is normal, then doing the hormones, if they are okay, then would find other things maybe to do for them, like genetic tests if they are needed. Yeah.
And then we have another one who is asking about prolonged bleeding when she's not even using any family planning method. Mm-hmm. Okay,
I must say we've had quite a number of people having that issue, where you find the menstrual periods are so prolonged, even when you're not on family planning. It could be, we would need to understand the situation, whether it's something new or it's been there for some time. Some causes of prolonged periods could be hormones, maybe they are quite unbalanced, or else like you have any structural abnormalities in your uterus, like fibroids, or some conditions like endometrial hyperplasia, where the endometrial lining is very thick, and then you have to bleed for a longer time for it to shed off completely. But I must say it has a solution. Depending on the cause, the different causes can be addressed and the periods can be shortened.
Okay. Dr. Moses, are you back with us? If you are?
Yes.
Okay, now, this is, I'm sure this is a medical student, trust me, from Makerere University. Is there any chance of HDN, I don't know what that means in full, it's your medical term, if the mother is blood group O+ and the husband is blood group O-? What is the best treatment modality for a mother expected to have a baby with the risk of HDN?
If the mother is plus. Did you say O plus?
The mother is the mother is O plus and the husband is blood group O minus.
Then there is no chance of her having any HDN. HDN is a hemolytic disease for women who normally who are rhesus negative, who are rhesus negative, and the produces antibodies if her child has a rhesus positive child. However, it has to be the mother has to be rhesus negative and the child has to be rhesus positive. It can't happen if it's the husband who has who is negative. If the mother is positive, there is no chance of them having that disease.
Okay. Then they're also asking, what's the effect of masturbation on fertility?
Unless you're doing it a lot, there's almost no effect of masturbation in infertility. In fact, sometimes we do ask some men to masturbate a bit more, especially if they have something called a high sperm DNA fragmentation, which affects the DNA that is on the sperm. And so sometimes we ask men to masturbate a bit more before having intimate intercourse. So as far as we know, there is no negative effect of masturbation unless it's preventing you from actually having intercourse with your partner.
Mm-hmm. Then coming to you, Dr. Judith, this is Ivan from Tinder. I am 60 years old. My wife is 39 years old. I still see our children. What are the risks associated with this kind of pregnancy if he still intends to see any kids?
I must say for the female, 39 would be a little bit also on the high end, but she would conceive. The risks involved in view of the lady's age, 39, then the male's age, 60. In this case, as you grow older, the risks of genetic abnormalities increase. They can have increased chances of having children with abnormalities, but it's not absolute. They can as well have normal children. There is a chance, a bad chance, but there is also a normal equal chance of having normal children. Mm-hmm. But would need to find out if they are struggling to conceive. Mm-hmm. If they would need to, if they wish to try naturally to have children, or if they are considering maybe IVF. If they are considering like IVF, there is a provision of doing a genetic test on this child before putting the embryo into the mother, so that we zero down to a normal child. Mm-hmm. But if it's a normal, if they are trying naturally to conceive naturally, they just have to try their luck. It may either be a normal child or there is a risk of abnormalities. Mm. But the chances, I must say, they are equal.
Okay. Then my wife has okay, actually I think what he meant is his wife is 2 months pregnant, but she passes out whitish water every time. What is the problem? And they have checked and there is no infection. This is KB from Kawempe.
Any discharge in pregnancy, it may not be abnormal. Some discharge may come due to the hormonal changes, in that there will be increased secretions due to estrogen as one of the hormones. If there is no itching, the discharge is not foul smelling, I wouldn't think it's abnormal. But maybe the person can stay conscious about any changes in the discharge and what they use to take normal, maybe in the initial months of pregnancy. But otherwise, it is expected that the discharge can change in pregnancy, but it may be a normal change, it may be abnormal, but if you've ruled out infections, I don't think it's a need for alarm.
Okay, then you still, okay. The ladies also fully participating on some of their issues, possibly that we didn't address the other time, or if they missed out on the show the other time, but still, yeah, we will address them. Here is one, she's 36 years old and they have a number of days of periods, which has decreased from, she says decreased, I think it's increased, from 3 to 4 days, 2 to 3 days, and they are very light. She has failed to conceive after 9 months of trial. what could be the problem? So in other words, she meant to say they have increased, because if she's been having them for 3 days, now it's 4 days. When they're supposed to be for 2 days, then they are 3 days, and delay to conceive.
Did she mention the age?
She didn't mention the age.
I think really age would matter in her situation. There are some conditions which may make the periods lighter or even more, like things like uterine fibroids. And I don't think, some would affect fertility, others may not. So she would need to seek medical help, and they would find out exactly what is causing the periods to become light and the cause of the delayed conception.
Okay, and then Dr. Moses, for you, for career women who want to have children after retirement, possibly they might need a word of advice from you, because she just left it hanging there. After retirement, because if we're talking about retirement, I'm looking at it, that's officially here, it's 60 years. So I don't know if that's the age bracket she meant, or I don't know.
Okay.
After 60 years.
Actually, you mentioned that, but it is a common thing happening, that there are many women who want to put off starting a family until later in their career. Not many really say after retirement, but later into their career. The easiest one where you can actually have, if you're single, if you're a woman and you're single, you can freeze your eggs while you're younger. We normally advise the best age to freeze your eggs is before your 35th birthday. So you can freeze your eggs if you're single. And then later on in life, when you're ready to start your family, if you try and conceive naturally with your partner and you're not able to, then you can use the eggs that you froze when you were younger. So that's one option, which is called egg freezing. If you are married or you have a long-term committed partner, and you don't want to have children yet, you're still putting it off, then yes, you can freeze embryos. That's where we collect your eggs, fertilize them with your partner, and freeze them, so that later on, when you decide to try and get pregnant, if you're having difficulty again conceiving naturally, you can resort back to using the embryos that you froze when you were younger. Now, however, if you are thinking about having children when you are post-retirement, and I think the official retirement age in Uganda is 65, if I'm not mistaken, that is quite old. It's unlikely you're going to conceive naturally with your own eggs. If you haven't frozen eggs before you went through the change, then the very successful solution in such situations is to use donor eggs, which is eggs from women who are normally under the age of 35. These women could be related to you or could be anonymous who you don't know, and we can get their eggs, fertilize them with either with your partner's sperm or with donor sperm as well, create embryos and put them into you, and the success rate is extremely high. It's more than 50% if you use donor eggs.
Now I would like to ask this before we get into a commercial break. Hello, Dr. Moses. This is Arari. I went to the doctor with pain in the pelvic region. He recommended for a scan and a urinalysis. I even went further and did a urine culture. Later, I was put on a dose for a UTI. So far, I have taken 3 separate doses for the same reason, but the pain has never stopped. What could be the issue?
One of the things that says, if they diagnosed a urinary tract infection and they treated it, did they check afterwards to see that the infection had actually been eradicated? It's called a proof of treatment, which is you check your urine again after you've completed your antibiotic course. So that's the first thing. Secondly, if this has happened and you're still getting pain and the initial urinary tract infection has been excluded, then you should also look at other things, such as carrying out an ultrasound scan to see, do you have something like a endometriosis, which affects roughly 10 to 20% of all women, and this pain is normally strongly associated with the period. It's either cyclical, where it occurs almost at the same time of the month, or it occurs with the periods themselves. So that is something that can be investigated. You can also do pelvic ultrasound scans to see if you have things like fibroids, which can sometimes cause pain or very painful periods. So there are a variety of things we can do. If we have ruled out infection or you have treated infection, then come to see your doctor, come to us, and we can investigate, find out what other causes are.
Okay. At this particular point, I would like us to take a very short commercial break. And when we do come back still, Moses is here with you, and so is Dr. Judith.
Malaria lurks, always waiting to strike. But fear not, for here comes Mr. Vaxxer, the ultimate protector against malaria. For years, malaria has been one of the biggest threats to children under 5, making them weak and even putting their lives at risk. But now, the government is introducing a new solution, the malaria vaccine. The malaria vaccine is now in the routine immunization schedule. The malaria vaccine is administered in 4 doses at 6 months, 7 months, 8 months, and 18 months. This vaccine will provide extra protection against severe malaria. And don't forget, routine immunization protects children from many deadly diseases. Every vaccine matters. Visit the nearest health facility for routine immunization services today. Mr. Vaxxer, the malaria vaccine is free, safe, and ready to protect our children. Will you join the fight and complete all 4 doses? For more information, call the Ministry of Health on 0800 100 066. This message is brought to you by the Ministry of Health.
Pick of the day on UBC. Was brought to you by
I'll call you every day, yeah yo, baby dundolo.
You can now get all the Chibuzi out with MTN voice bundles. Call all networks. Kubei Dondoro. Buy a 25-minute voice bundle for only 1,000. Or buy any daily voice bundle of your choice. Dial *100 *21 hash and select daily, or use the My MTN app. When we talk together, we are unstoppable.
Hello, Kampala, Uganda. In response to the national call of strengthening the traffic security, Good Products Group HGO brand has officially launched the Rider Selection Campaign. Registration is now open. Visit www.riders.hgo.com. Complete your registration now for a chance to win exciting prizes including motorcycles, exclusive HGO gift boxes, and official rider vests, all while promoting safe riding awareness. This is how to participate. Pay the registration fee, invite free friends to form a team of 4, and your registration fee will instantly be refunded. Begin your journey of honor today. Don't miss this opportunity. Join the challenge, promote road safety, and become a pioneer rider. For details, visit the official Good Products website at www.hgo.com or call toll free 0800-335-555 or visit our offices at Kingdom Kampala 3rd floor to register now and win prizes worth millions. Uniquely ours. Explore Uganda.
Are you an elite runner, a fitness enthusiast, or just looking for adventure? Get ready to run in paradise at the Fort Portal City Marathon on the 19th of July 2025. This is your race to experience the beauty and culture of our tourism city. It's all breathtaking for only 50,000 shillings. Register now at www.fortcitymarathon.com or come to Wazalendo Building, Room 9 in Fort Portal. The Fort Portal City Marathon, Mwija Tugende Toro, for a run in paradise. In partnership with Rock Telecom, Data Cities, Sams, and
UBC, inspiring Uganda.
and Toro Kingdom.
In the neighborhood, near stagnant water and mosquito breeding sites, malaria lurks, always waiting to strike. But fear not, for here comes Mr. Vaxxer, the ultimate protector against malaria. For years, malaria has been one of the biggest threats to children under 5, making them weak and even putting their lives at risk. But now, the government is introducing a new solution: the malaria vaccine. The malaria vaccine is now in the routine immunization schedule. The malaria vaccine is administered in 4 doses at 6 months, 7 months, 8 months, and 18 months. This vaccine will provide extra protection against severe malaria. And don't forget, routine immunization protects children from many deadly diseases. Every vaccine matters. Visit the nearest health facility for routine immunization services today. Mr. Vaxxer, the malaria vaccine is free, safe, and ready to protect our children. Will you join the fight and complete all 4 doses? For more information, call the Ministry of Health on 0800 100 066. This message is brought to you by the Ministry of Health.
Welcome back from that short commercial break. You're still watching the Health Q&A, where it is your show. That's why you're fully participating and engaged, because you would like to know. And it's amazing to see how much the women are fully participating in the male's topic and also have their underlying issues. Women will use whatever opportunity it takes for them to be able to seek that knowledge. Men, let us improve the health-seeking habits. I'm not the expert on most of these subjects. Dr. Moses is participating and is here to respond to your queries all the way from Dubai, and with me in studio is Dr. Judith. Now, Dr. Judith, you still were burning to add on to the last conversation before we went in for a short break, based on what Dr. Moses had guided. Please go ahead.
Thank you very much. I'm still responding to that person who said they've been treated for UTI now 3 times, but they still haven't improved. I must say UTI is not equal to STI. Some medication can eradicate the urinary tract infections, but certain sexually transmitted infections may need specific treatment, which is usually more than one kind of treatment. So if this person hasn't had an improvement despite the previous medications, I would encourage them to do specific tests, like for sexually transmitted infection screening, chlamydia, gonorrhea. They have specific tests. Some of them, some STIs may give you a negative urinalysis, and that doesn't mean that you don't have them. And how we can eradicate the sexually transmitted infections, sometimes we need to treat all the partners involved. If you treat yourself, even though we give you adequate treatment for a sexually transmitted infection, without treating your partner, sometimes the infection will reoccur. Thank you.
Okay. Now to you, Dr. Moses. This is Dennis from Masindi. Why would a man fail to have a second child after trying for 3 years? How best can I treat is it called epididymitis? Because it's reoccurring.
Okay. That is a question which about what is the actual underlying cause. So he has had a child in the past. This is secondary infertility. One, it's important to investigate both partners. On the male side, he has mentioned that he has epididymitis, which is inflammation on the tubes that carry sperm from the testes to the penis. So it's important that firstly, he has a semen analysis to see if his semen analysis is normal, and then also gets proper treatment for this infection, and to make sure that it is completely cured, it's fully cured, and repeat a semen analysis to see if his semen analysis is normal. If it's normal, then we should also investigate the female partner, because although they've had a child in the past, we don't know how old that child is, we don't know how old his female partner is, because those are 2 very important factors in whether a woman will get, how easy it will be for the woman to get pregnant, which is her age. But both of them have to be fully investigated, and he has to be treated properly for his epididymitis.
Mm-hmm. Then there's another person asking you, this is from Bukedea. Why do men feel pain on the back when they have not had sex for a long time? Mm-hmm.
I can't say that has come across. I've not heard about that. Why would a man have pain on his back when he hasn't had sex for a long time? Um, a simple answer I have is I'm not aware of any long-standing reason why a man would have pain after not having intercourse for a long time. There's no known reason why a man would have any pain whatsoever if they have not had it. But I don't know whether it is the other way around, whether the pain in the back is what is causing him not to want intercourse. If that could be the possibility, it's rather that he's more or less putting the hen in front of the egg, and there are men who don't want to have intercourse because they're having chronic pain, chronic back pain, and if that's the case, he should be investigated, find out what the cause of his back pain is, because if that is addressed, then possibly it will allow him to have more intercourse more easily.
Okay, then this still comes to you. Can someone who is considered impotent erect and at times ejaculate when he masturbates? They are considered
Yes.
impotent.
Yes, men who are considered impotent can get erections and can ejaculate as well. There are many causes of impotence, but the main, some of them are medical, but the main causes of impotence are really psychological. And again, that can be addressed by a psychosexual counselor. But there are also medical reasons, or even people who are taking certain medications which can cause impotence. There are medical conditions such as diabetes, which can lead to impotence, kidney disease. There are treatments for hypertension or high blood pressure, which can cause impotence. And so with all these different arrays, depending on how you manage them, if it's psychological, psychosexual counseling can lead you to then start to overcome the psychological issues that were causing impotence, and that would then allow you to have an erection and ejaculate. Whereas if it's the clinical aspects such as diabetes or the medication you're taking for high blood pressure or hypertension, better control of your diabetes can then reverse the damage that is happening to the nerves and then lead you to have an erection and ejaculate. And also changing your medication if it's particular medications for hypertension. Those are the most common. Seeing the doctor who started you on these medications, discussing this and finding a better regimen of drugs which will not have the negative side effect of impotence can lead you to then have an erection and ejaculate as well.
Okay. Now I come to you, Dr. Judith. This is Raphael from Mobende. Among the two parents, who determines the sex of the child and the blood group? We're getting back to our science of the X and the Y chromosomes.
So I must say, just like Dr. Moses had earlier said, the sex of a child, the man will provide both the X chromosomes and the Y chromosomes, and the chances will be equal that this woman can get pregnant of a male child or a female child. So they have equal chances. Then if this couple is undergoing IVF, they can determine which eggs or which embryos carry a Y chromosome, that would be a boy, and then which ones carry the X. And then they would put for you the sex that you would wish. But largely, if you're trying naturally, the chances are the same, and it's the man who determines.
Then Dr. Moses, this is to you. What happens with someone who has 0 sperms, yeah, and his testosterone level is okay, PSA okay, HL okay, and FSH is less or low? What is this called?
So with the azoospermia with a low FSH, this would be known as pre-testicular azoospermia. So the underlying cause is actually in the brain. It's not in the testes, it's not after the testes, it's actually in the brain. And there are a variety of reasons, which could be, one, have they been treated for something like like cancer in the past and they had chemotherapy? Have they had a genetic condition such as Klinefelter's, which causes them to have a low FSH level? Have they got hypopituitarism? Did they have a car accident which had a head injury when they were younger, and it can cause a severing of the stalk that carries hormones from the hypothalamus to the pituitary gland? So these are the most common reasons why you have a low FSH level, but yet you have a normal testes and a normal testosterone. Actually, this is something that is very, very easy to treat. It's not difficult to treat at all, because once we know that the cause is pretesticular and your FSH is low, we can give men FSH injections, and this will in turn lead to their testes then producing sperm, and they are able to actually conceive naturally. Or alternatively, if they don't want to do that, we can actually collect the sperm directly from the testes and actually perform IVF, where we collect the woman's eggs and inject the sperm directly into the eggs, and they have children. But there are many solutions for this kind of scenario, very many.
Okay. Now, it looks like there's a lot of conditions that still come up that are underlying the whys, the who, how, what. But now, what is the solution to some of this? Because, doctor, if a man has got those 00, like it has been indicated, but would like to be a father, you might want to guide and give us a direction on what could be the solution. Does IVF fit in right well in this kind of situation of infertility among men?
Okay. Sophie, thank you. Now, as I said, when they say 00 sperm, we call that in the medical field, we call that azoospermia, which is not producing any sperm. And for azoospermia, there are some irreversible causes in that there's nothing that can be done. But this is the minority of reason of issues. And then there are reversible causes, of which there are very, very many. There are many reasons which a man is not producing sperm, and yet there are things we can do that can reverse it. The previous question we spoke about a low FSH level. And these are this is the reason why we do some of these investigations. We do a hormone profile. If the FSH level is low, this is because FSH is a hormone released in the pituitary gland of the man, and it's released and it causes production. It controls the production of sperm in the testes. If we notice that the FSH is low, there are solutions. One of the solutions is to actually give these men FSH. We can give it as an injection, and this injection can then in turn replicate what happens in nature and switch on the production of sperm in the testes. This can be done. This can be easily done. It sometimes requires 2 to 3 months of treatment, but it can be successfully done, and either done by a clinic like our own, or even you can go and see your urologist, who are doctors who specialize in treating men. Okay. The other alternative for these causes is we can go directly into the testes and collect sperm surgically, and then we can use that sperm during an IVF process to fertilize the female partner's eggs. So what I've said is, one, it can be done so that you can actually get pregnant naturally. And that is, we give you the injection, you start producing sperm, you then go and have unprotected intercourse with your partner, and the chances of conceiving will be very, very good. Just as good as a man who has a normal sperm count, once you start producing sperm again.
Mm-hmm. That's
if you have however, if you have a post-testicular cause whereby you have a blockage to the tubes that take sperm from the testes to the urethra, it depends on what the blockage is caused by. Some men, it's because they had a vasectomy where they actually wanted to have family planning and cut off their tubes so that they wouldn't have any more children. If it's done within 2 years, you can do surgery to reattach the tubes again. So that is reversible. However, there are also men with a genetic condition, which I described as cystic fibrosis, extremely rare in African men, more common in Caucasians and people from the Asian continent, whereby genetically they're missing the vas deferens. For these, there is no surgery that can be done. However, we can collect the sperm because their testes is actually producing sperm as normal. We can collect the sperm directly from the testes and then put the partner through an IVF process and fertilize the eggs with the sperm we've collected.
Okay, now coming to you, Dr. Judith. Somebody says, I have never experienced wet dreams, but I produce. Is there any problem?
I must say no problem. Wet dreams, some people may experience them, others may never experience them. They are very common, like at the beginning of puberty, before the hormones stabilize, but they can occur at any point in someone's life, but some people may never have them, and it's okay.
Okay, and then this one is asking, I'm Josephine from Kamuli. I'm blood group B+, and my boyfriend is blood group B+. How is that blood group? Can it affect us in future, marriage or their children? Because if they're the same blood group, B+, B+, that is what they would like to know.
To respond to that, rhesus positive never has any issue. That is a plus. If it's a negative for the woman, despite it being the same, maybe if the man is B+, then the woman is B-. That's where issues are. The woman having a rhesus negative. But if they are all positive, no worries. But if it was negative for the woman, usually that's where the other condition comes in, the hemolytic disease of the newborn. You may produce the first child, and the child is okay, but the other children may get affected, and you either get miscarriages or maybe death of the child at birth. Because the antibodies from the child, if your husband is blood group, any blood group, but with a rhesus positive, you're likely to carry a rhesus positive child. If you're a mother with rhesus negative, you produce antibodies against the rhesus factor of the child. But that usually doesn't affect the firstborn. It affects the other children following the firstborn. The other person had asked a similar question, which I think we missed out. He was asking whether the man or female is the one who determines the blood group. I must say it's a luck thing. Even when we have a mother, maybe O, then the father is B, a child can be blood group O, or can be blood group B, so the chances are equal. But we are conscious in cases where the mother is rhesus negative, then the father is rhesus positive. When chance strikes and the mother carries the rhesus positive child, maybe from the father, that's where issues arise. But the chances are equal, children picking up the blood group of the mother or father.
Okay. Then to you, Dr. Moses, what causes a woman's egg not to be mature during the IVF process or after going through the IVF injection? That's the person's question number one.
Okay, what possible reasons why an egg is not mature? It depends on, firstly, it depends on how many eggs are collected. If you collect something like 10 or 15 eggs, it is not that every single egg will be mature. You'd normally expect roughly 5 to 10% of the eggs collected, which could be 1 in every 10 eggs to be mature, and that is completely normal. We don't expect all the eggs to be mature. If, however, you have only 1 or 2 or 3 eggs that have been collected with women with low ovarian reserve, and when they're collected, they're actually immature, that could be an issue due to either A, the stimulation protocol that you had, was it not the correct protocol for you, for that patient in particular? 2, it would also depend on what trigger was used to trigger before the egg collection. Was it a HCG trigger or an agonist trigger? That can determine whether full maturation of the egg occurred. So also what the hormone levels, what were the estrogen levels high enough before the trigger was done? So those would be the 3 main causes as to why a woman's egg is immature after egg collection in IVF.
Okay, then still the same person is asking, what causes a failed sperm in a man for IVF fertilization through operation. Does it mean that some men have no sperm?
Sorry, I don't understand what they meant by failed sperm.
What caused a failed sperm? I don't in a man for after IVF fertilization operation. Yeah.
I think they meant maybe failed fertilization. So with failed firstly, most of the time, failed fertilization is normally attributed to an egg problem. So you'd first need to understand, know what is the age of the female partner, because that could be a contributing factor. Two, if it's a male sperm, is what type of fertilization was done? Was it just IVF or ICSI? IVF is where they just pour the sperm into a dish and the sperm swim on their own, but ICSI is where they inject the sperm directly into the egg. And ICSI normally has a better fertilization rate compared to conventional IVF. Then thirdly, there are some men who have had previous trauma or previous surgery to the testicles and have developed what they call sperm antibodies, which are antibodies that attack the sperm and cause them to clamp up. So again, sometimes when we do some clinics, some laboratories which do semen analysis are able to actually pick up whether there is an increased amount of sperm antibodies in the semen. And then lastly, it would be something called raised sperm DNA fragmentation, which is the DNA that is around the surface of the sperm being damaged, and this can cause a decreased fertility rate of the sperm fertilizing the egg. So there are a variety of reasons, but a full history needs to be done, and also the circumstances of the female partner need to be fully understood before you come to what the reason was for failed fertilization.
Now, Dr. Moses, interesting. You have a person from Nigeria, because it's +234, who is watching the show on YouTube, and they're asking for your number. That will be entirely up to you. I have a lot of ladies who are still coming through with their issues, fibroids here and there, asking questions left, right, and center, and they surely feel the ladies have taken over. They really want to deal with their issues. Now, this is, I'm Caroline, 45 years old, and first, I don't have appetite for sex, and secondly, yeah, she just doesn't have the sex drive. Maybe she has low libido, and she's 45 years old. Maybe, Dr. Judith, you could respond to that?
Thank you very much. Concerning the libido, really, I must say it's normal as you grow older for women. It gets lower because the hormones really reduce. And in this particular person, I would be interested in knowing if they're still having their periods, then would be able to track if they are still within the reproductive age or if they are crossing into menopause. But there are things which can help them regain maybe the libido if they are approaching menopause. Maybe we can have preparations like creams. If they find a problem lubricating enough, it can help. Then also would need to know their hormonal levels and be able to track where they are, whether in menopause or premenopausal.
Okay. Yeah. Then you have one who is, oh dear, I feel for you, Mading from Lozera. My wife is not on family planning, but from the day she produced, she has no feelings whatsoever. What could be the problem?
For such cases where the libido is low, now this even answers for the previous person, largely sex is psychological. So there are many psychological issues that may need to be addressed why this person, following the delivery of the child, they are no longer interested, they are no longer having the libido. We would need psychotherapy as the first step of dealing with the problem. If that is not helping, then maybe we can come in as the medical team to also understand what could be contributing to the low libido. Then it would also involve maybe the person looking into their lifestyle. If there are any lifestyle changes that have happened following delivery, maybe some people may gain too much weight and they are not happy with their body shape. after conception, maybe losing some weight would build their self-esteem and maybe they would be able to regain their libido again. Maybe also the foods they eat. There are some foods which maybe may also reduce the libido. Really, it would be a comprehensive approach, but first line would need psychotherapy,
Okay.
a counselor for.
Okay, then to you, Dr. Moses, this is Henry Chigundu from Oyam. Does hernia disease affect one's sexuality or ability to have children?
Hernia, well, I don't think hernia disease affects sexuality, but it can affect your ability to have a child in a number of ways. The first one is some men who have hernias may have had undescended testicles as children, and therefore the quality of the sperm may not be as good. Secondly, hernia disease, the tubes that take sperm from the testes go through the inguinal canal, which is actually where the hernia is. And so they could be it could be effect of a partial blockage, or the temperature of the tube is raised as it goes through that long pathway, as it makes its way towards the urethra. So yes, it can. However, I must say there are many men with hernia disease who don't have any problems with their sperm count, but we do know that the proportion of men with hernias that have problems with their sperm count is much higher than those who do not have. So it can affect, and you should have it checked.
Okay. Then this is Moses from Muyenga, who is asking what causes too much pain of the balls. He's really having possibly serious issue in that area.
Okay. If he's having scrotal pain, one, it could be an infection. That is the most common cause of scrotal pain. So he should have a semen analysis, and also should check his urine for any signs of an infection. He should go and see a doctor, or come to. We're more than happy. He's in Muyenga. He can come across to us in Intinda. We can be examined to see if there's any signs of inflammation, especially to the epididymis, and that can then lead us to investigate and then treat. We can also carry out ultrasound scans, a genital tract ultrasound scan, that can help us again diagnose and see if there's any inflammation of the testes itself, if there are any masses that could be causing this, if they are swollen blood vessels, something called varicocele, which is the blood vessels that supply the testes become very swollen and engorged and enlarged, and these could all be contributing. So it is worth coming for us for investigation. The most common one is infection, which would rule out, but would also be able to investigate other causes of what can be leading to this pain on the scrotum.
Okay. Now this one, this one hasn't mentioned who they are. Let me see. It's okay. He says it's James. He's a male of 33 years old, and these are his questions. I did a sperm analysis, and these were the results. Sperm count 7, motility 36, progressive motility 28, and then there is morphology 72%. Do I have to worry? And are there any medications to increase his sperm count, or any kind of foods that can help him to improve the sperm count?
Okay, listening to what you've just described, there are a number of, I'd say he has moderate male infertility, and this may cause him to have a lot of difficulty trying to conceive naturally with his partner. It's not impossible, but conceiving naturally with his partner may be extremely difficult. He has, the normal sperm count should be more than 15 million per male. His is at 7 million. So that is significantly decreased and would cause difficulty in trying to conceive naturally. Secondly, his motility is also decreased. It's at 32%. It should really be above 40%. So his swimming sperm is decreased as well. And lastly, the morphology, which he described as 72%, should be above 80%. So all the parameters he has described are lower, and that would negatively impact his ability to conceive naturally. There are options. The first option may be trying to do what we call well, first of all, it's important to investigate and see if there are any reversible causes for what he's going through. Also to check that he had actually done the semen analysis properly. Had he had a minimum of 3 days of abstinence and not exceeding 5 days of abstinence or masturbation before he produced his sperm analysis. If it was done properly, then it's about understanding what could be the possible reasons for this. Does he have a chronic illness that can be stabilized better? Does he have is he taking medication which could be negatively affecting his sperm count? Is he very athletic and or maybe plays a lot of competitive sports and is taking things like testosterone or steroids to get into better shape or to help him perform better? All of these could negatively affect his sperm count and lead to this, but stopping them can reverse it and take it back to normal. However, if we find that this is what his baseline semen analysis is like, there are interventions which are not very expensive, things like intrauterine insemination, where we take his sperm and spin it at very high speed to make it concentrated, and then get his partner at the right time of the month when she's about to ovulate. We inject it into her when she's fully awake. It's a simple procedure, just like how you have a pap smear done, which women have every 3 years, and just insert the sperm at the right time of the month. As long as she's under the age of 37, which gives them a good chance of success, they can have a success rate of about anywhere between 15 to 20% of them becoming pregnant in that cycle where we do the intrauterine insemination.
Okay, then I come to you, Dr. Judith. This one is Grace from Kumi. I'm 30 years old. My husband is 39. We have a child who is 7 years. But after that, I have had 3 miscarriages. All happened between 5 to 9 weeks. What could be the problem? 5 to 9 weeks miscarriages.
Okay. Usually, just like last week, we talked about the miscarriages. Miscarriages happening before the age, before 12 weeks. That is the first trimester. Maybe with a problem with formation of the embryo itself. In that there may be some genetic mutations in this particular fetus which is forming, in that even though it continues to grow, it may give you an abnormal child. But having had a normal child, I would think still they can have another healthy baby. But 2 would be bearable, but if someone is having like 3 consecutive miscarriages, then would encourage them to undergo further screening where we do specific tests to identify why they are having recurrent miscarriages. And in this case, sometimes you may find a severe defect, maybe with the second phase after implantation, like implantation, things to deal with the implantation, where we have luteal phase defect maybe. So such a person would benefit from hormonal supplementation when they have conceived, like for the first 3 months to prevent the recurrent miscarriage. Then also for some people, if that is not helping the hormonal therapy and they are still losing the pregnancy, we would want them to undergo maybe IVF, and then we can do the screening on these embryos before they are put in to ensure that there are no genetic mutations. Yes.
Okay. Then there was a lot of ladies are also still fully participating. And then they're asking, now this is to you, Dr. Moses, I don't know, because this is still in line with infections and also to you, Dr. Judith, some of the infections that they say that keep on affecting here and there. What is the main medicine for infections? Because I took a combination of metronidazole, there's this, is it called drug V, and then fluconazole, cephalexin, and they're still having, I think, issues. I don't know whether it could be a female, yeah, who is asking, because the combination possibly is what they would like to know about, but I think it varies on the extent. of the UTI or whatever it is that infection that they're trying to treat?
Say different infections are treated differently.
Differently, yeah.
So the goal in a person who has had recurrent infections would be to find out which infection we are dealing with, and it would be a targeted intervention to deal with that specific infection.
Okay. There are some questions that are really like, okay. Also, Angela here from Kawempe, what causes pain when you're having sex? That is for you, Dr. Judith.
Okay. So I must say pain during sexual intercourse is not normal. It may range from superficial pain, like maybe just mere touching, or superficial, maybe penetration, that someone feels pain. On the outside, we may need to know, are there wounds? Is the person well lubricated for the intercourse? Those ones can cause superficial pain, or even pain without penetration or superficial penetration. But if someone feels much pain on deep penetration, usually it may be issues to deal with the cervix, things to deal with the uterus itself. That's where things like pelvic inflammatory disease would come in to cause. Usually it is specific in a way that it causes deep dyspareunia, which is deep penetration pain, or pain over the cervix. Any emotion over the cervix, if someone has a PID, it would cause pain. And also other infections like cervicitis, just an inflammation of your cervix would give you pain. Then things like endometriosis as well would cause pain in the pelvic region associated with the sexual intercourse. So someone may be complaining of pain, but it may not be only in their private part, but also pain in the abdomen associated with sexual intercourse would cause worry, and it would need further evaluation.
Okay. Then to you, Dr. Moses, may I know the best time for a man to check their fertility with a woman who has just finished menstruations? And this is Bim Patrick from Arua. When is the best time for them to check their fertility?
The best time for a man to check his fertility is really, it's not really at the woman's cycle, but it's as long as he has had a minimum of 3 days without sex or masturbation and a maximum of 5 days. So he shouldn't wait for more than 5 days, but shouldn't go for a period of less than 3 days of abstinence. And that is the ideal window, between 3 to 5 days after of sexual abstinence, and also avoiding masturbation.
Then here you have a 22-year-old, she says, and she has low libido. What might be the cause? At 22.
At 22, it could be a variety of reasons. Most likely it will be hormonal, and so that's one thing that can be easily checked to see if her hormone levels are normal. It could be psychologically as well. That she is she in a relationship? Is she in a loving relationship? So there would be a variety of reasons, and it's important that we actually take a history. But most likely at her age, it could be a hormonal imbalance, and that can be investigated easily with some blood tests.
Does a nurse... Okay, wow, some questions are just a little too hard. And they would like you to tell them about foods that can increase fertility, because he has spent a year with a wife, but no pregnancy. So sometimes people prefer using the natural remedies. When we go to Mr. Google, we are told if you take this food, if you take this, say like how they say that cinnamon will help to to reduce the blood sugars. So kindly guide.
The only supplements that we scientifically advise people to take when trying to conceive are one, folic acid, which is a form of vitamin B, which actually helps when a woman conceives, for the baby's brain and neurosystem to be developed properly, and it avoids a condition called spina bifida, which is herniation of the spine. That's the first one. The second one that we advise couples to take when they're trying to conceive is vitamin D, which we mainly get from the sun, but because of the melanin in our skin, it is resistant to absorbing vitamin D, and therefore we don't, many people, especially people of dark skin, do not absorb enough vitamin D, which helps with the normal development of the skeletal system and the bones of a child.
Okay.
Regarding whether there are any other foods out there that can improve your chance to conceive, there's nothing that we know that actually has scientific evidence that it will definitely improve. Many people talk about supplements such as zinc, magnesium, selenium, which you can get in things like greens, like spinach, but I wouldn't say that there is any hard evidence that shows that these different supplements actually improve, that when ingested actually improve. However, with this person's question, he and his new wife have spent 1 year trying to conceive and they have not managed to. I think it's very important that they actually seek proper medical advice, get investigated properly. The man has his sperm count tested. The woman has a ovarian reserve, her tubes checked as well, and then we may be able to give them answers that are actually going to be of benefit to them, so that they can seek treatment that will actually work. So I wouldn't say that they should think it's foods that are causing their problem. I'd say get investigated properly, and then probably we can come up with a good treatment solution for them.
Okay. Then to you, Dr. Judith. I am Eunice, 42 years. Is it possible for me to get pregnant because I'm over 120 kgs?
Now, for the weight, yes, we know it negatively impacts the ovulation, but it varies from one individual to another. Someone may be overweight, but they're not having a problem with ovulation. They are still having regular periods. So it varies from one person to another. For that particular person, being above 35 years, we would need to assess them and know if they are still having regular periods, how their ovarian reserve is, and then would guide better.
Okay, then this is Brenda from Gulu. I have been on Clomid, for 5 days today. Is the 11th, but I have been feeling pain during intercourse for the past 3 days. What could be the problem? And then she also feels pain when the bladder is full. Clomid. I thought Clomid serves another purpose. Okay.
Yeah, really it's a medication for stimulating ovulation. Sometimes it may have other side effects, but these side effects may vary from one person to another. I can't say everyone who takes Clomid experiences that. But for all the medications, people give you medications if the benefit outweighs the risk. So I would want to know from that person if it was a prescription by oneself or from a medical personnel, because every medication may have a side effect. We only come in if it is too overwhelming and not bearable for you. I would encourage maybe they discuss with a person who prescribed for them and have a more discussion if they could consider maybe something different on the next stimulation, just in case maybe we are not successful with the current cycle. But
Then
honestly, the side effects vary from one person to another.
Okay. There are still a lot of questions coming through, but I mean, we're almost hitting the top of the hour, and I'm sure we will not be able to, because they keep streaming through and through and through. This is your show here, and I do really appreciate the fact that you've been fully participating, but I mean, every good thing almost comes to close to an end. Now, first I'll get to Dr. Moses, because you have addressed a lot of issues for the gentlemen out there, and I know there's still a lot of burning questions. I'm amazed to see that people who are participating even from across the board. I'd like you to share your take-home message with the person who is watching right now.
Okay. Thank you, Sophia, and thank you for hosting us twice, last week and this week. This week has been mainly about male fertility, and my the take-home message I'd say for men is one: there's a lot of help out there. Don't be afraid to ask. Don't be afraid to get investigated. male factor contributes to about 40 to 50% of the reason why couples have difficulty getting pregnant. It's a very common problem. You're not alone. There is help with our clinics. There's help in your families when you speak to them. Don't feel you have to be strong and suffer in silence. It's much better for your own mental health to speak to people who are able to help you. And we are able to help you, and the success rate is just as good as if you did have a male problem. Thank you.
Okay. Then, Dr. Moses, are you comfortable sharing your WhatsApp line? Because the rate at which some of them are asking for your direct WhatsApp line, if you're not, we can leave it at that. I don't know if you're comfortable sharing your WhatsApp line.
We can, Dr. Judith has our clinic number. We're very happy to share that. And we encourage people to send us messages, and then we can actually set up consultations. Actually, one thing which we were very happy to offer to people who who follow your show, Sophie, is we were happy to offer free 15-minute consultations for people if they want to discuss some issue. But it'll only be a 15-minute consultation with either myself or with Dr. Judith. And then afterwards, if you're happy, we can then arrange a more formal interview. But Dr. Judith will give you our WhatsApp number, and we'll be more than happy to arrange a free 15-minute consultation with anyone who wants. Or if people want a formal consultation, we can arrange that as well.
Okay. I'd like to thank you so much, because blocking off 2 hours from your busy schedule to be able to educate the masses and to share such useful information is not a thing we can take for granted. We at UBC would like to say thank you so much to you. Okay, now
Thank you very much.
Okay, now I get to you, Dr. Judith. What is your take-home message for a person who is watching the show?
Thank you very much, Madam Sophie. To the viewers, thank you very much for listening in, for your precious time. We appreciate. My take-home message would be to the couples: it shouldn't ever be a blame game, thinking the woman is the one with the problem for fertility. But even the men, we have to know that these things are common and they affect both women and men equally. And the men should always accompany the women for the fertility consultations, so that both people are helped.
Mm-hmm. Then for your WhatsApp, because you did promise to share the WhatsApp line, because many people are asking for your personal number and Dr. Moses' personal number. Maybe just like you see the advert running on screen of Ministry of Health, there is a number always at the end that shows that should you have any further questions, you dial that number. So, or you call it. Is it toll-free?
You can, no.
It's not toll-free, but yeah, surely, please do share the number so that for any further questions, I know I can see the tab is streaming with still a lot of questions that unfortunately we're not going to be able to address. You can get in touch with Dr. Judith or Dr. Moses. Please go ahead.
So you can call us on our WhatsApp number or even a phone call, 077 04 62 432. I repeat, 077 046 2432.
Okay.
Thank you very much.
Okay. Thank you so much, Dr. Judith, as well. It's just 3 minutes to the top of the hour, and we're just going to go a little bit light in our normal programming. Right after this, we are going to get into the lunchtime cruise, and then later on in the day, there's going to be a presidential zonal tour, PDM zonal tour, that is going to take place in Nabwero. Keep watching UBC for the rest of our programming.
Near stagnant water and mosquito breeding sites, malaria lurks, always waiting to strike. But fear not, for here comes Mr. Vaxxer, the ultimate protector against malaria. For years, malaria has been one of the biggest threats to children under 5, making them weak and even putting their lives at risk. But now, the government is introducing a new solution, the malaria vaccine. The malaria vaccine is now in the routine immunization schedule. The malaria vaccine is administered in 4 doses at 6 months, 7 months, 8 months, and 18 months. This vaccine will provide extra protection against severe malaria. And don't forget, routine immunization protects children from many deadly diseases. Every vaccine matters. Visit the nearest health facility for routine immunization services today. Mr. Vaxa, the malaria vaccine is free, safe, and ready to protect our children. Will you join the fight and complete all 4 doses? For more information, call the Ministry of Health on 0800 100 066. This message is brought to you by the Ministry of Health.
Hello, Kampala, Uganda. In response to the national call of strengthening the traffic security, Good Products Group HGO brand has officially launched the Rider Selection Campaign. Registration is now open. Visit www.riders.hgo.com. Complete your registration now for a chance to win exciting prizes including motorcycles, exclusive HGO gift boxes, and official rider vests, all while promoting safe riding awareness. This is how to participate. Pay the registration fee, invite 3 friends to form a team of 4, and your registration fee will instantly be refunded. Begin your journey of honor today. Don't miss this opportunity. Join the challenge, promote road safety, and become a pioneer rider. For details, visit the official Good Products website at www.hgo.com or call toll free 0800 335 555 or visit our offices at Kingdom Kampala 3rd floor to register now and win prizes worth millions.
UBC, inspiring Uganda.
Hello, Kampala, Uganda. In response to the national call of strengthening the traffic security, Good Products Group HGO brand has officially launched the Rider Selection Campaign. Registration is now open. Visit www.riders.hgo.com. Complete your registration now for a chance to win exciting prizes including motorcycles, exclusive HGO gift boxes, and official rider vests, all while